Hello, today we will be presenting on periodontal disease. I'm Chandler Phelps.
And I'm Madison White.
Periodontal disease is a disease of the gums caused by bacterial infections that attack the gums and surrounding tissues, leading to infection and inflammation of the supporting structures of teeth. When bacteria remains on teeth for an extended period of time due to poor oral hygiene, the bacteria forms a film called plaque, which eventually hardens to tartar, and tartar buildup can spread below the gum line. This is a progressive disease, and its early stages are classified by the condition gingivitis. Gingivitis is an inflammatory condition of the gingiva, which is the soft tissue surrounding the teeth, and is a direct immune response to dental microbial plaque. The progression of the disease to periodontitis occurs as destruction of the supporting structures of the teeth, including the periodontal ligament and alveolar bone, begins to occur. Those with periodontitis are at risk of tooth loss because of this disease process. Periodontal disease symptoms include swollen or puffy gums, bright red, dusky red, or purple colored gums, gums that feel tender when touched, gums that bleed easily, and bad breath. Periodontal disease is most commonly diagnosed by a dental professional using a periodontal probe.
Okay, for the normal or healthy histology, the gingival epithelium is made up of three regions, the first one being a thick keratinized stratified squamous epithelium called the oral gingival epithelium. And then there are two regions of non-keratinized stratified squamous epithelium, and these are the junctional epithelium and the sulcular epithelium. Tight junctions between epithelial cells confer the function of preventing paracellular transport of substance such as bacteria. The keratinized cells of the oral gingival epithelium serve the function of providing protection against mechanical abrasion. The epithelial tissue of the junctional epithelium is directly attached to the tooth surface and has a very important protective function against periodontal disease. It contains wide intercellular spaces and fewer desmosomal junctions, which allows lymphocytes to travel to the junctional epithelium from the lamina propria to help prevent and attack diseased tissue, to help fight off infection. The junctional epithelium is attached to the tooth surface through hemidesmosomes, which also confers the function of frontline bacterial defense. The space in between the free gingiva and the tooth is called the gingival sulcus, and this area of potential space between a tooth and the surrounding gingival tissue is lined with sulcular epithelium. The mucosa also contains lamina propria and epithelium, and the lamina propria is loose connective tissue with type 1 collagen fibers made by fibroblasts. Fibroblasts are the primary cell type in this layer. The lamina propria also contains blood vessels and nerves. The papilla in this layer increases the surface area for epithelial attachment to the connective tissue. On the next slide, you can see a good picture of what the gingival sulcus looks like. In healthy gingival tissue, the periodontal ligament helps firmly attach the root of a tooth to the underlying bone. The fibers of the periodontal ligament are anchored in the cement layer of the tooth and in the alveolar bone. Oral mucosa is attached directly to the periosteum of the underlying bone with no intervening submucosa.
This cartoon image shows the disease process of periodontal disease. The disease process begins with the penetration of bacterial products through the epithelial lining. With both gingivitis and periodontitis, there is an infiltration of white blood cells in an attempt to fight off the infection. Blood vessels dilate to increase the number of white blood cells able to travel to the site of infection. The disease progresses to periodontitis when destruction of supporting tissues begins to occur, such as the degeneration of the periodontal ligament and bone resorption. These H&E stained images display the pathophysiology that occurs with gingivitis. The epithelium becomes hyperplastic, resulting in increased thickness of the epithelium. The pathogenic bacteria signals induce inflammatory signaling pathways and macrophages and neutrophils become immediately available to combat the pathogens. As this infection cannot be handled with the innate immune system only, the adaptive immune system is also required, and many lymphocytes infiltrate the diseased tissue. As we can see, there is dense infiltration in the lamina propria in this image, and this image also displays the lymphocytes present in the epithelial tissue as well. In the inflammatory process, blood vessels vasodilate to allow for the infiltration of these many white blood cells. The permeability of blood capillaries increases, and there is increased blood flow and leukocyte recruitment into the tissues. The inflammatory pathway, as well as edema resulting from the increased blood flow to the area, contribute to the swollen appearance of the gums. And in these images, we also see these many blood cells present to be able to transport all of these white blood cells for this immune response. This image shows the hyperplastic epithelium and associated loss of connective tissue papilla that occurs with periodontitis. So as we can see in the control image, there are lots of connective tissue papilla in this layer, whereas in the aggressive periodontitis image, we see a loss of this connective tissue papilla and the thickened stratified squamous epithelium. In these images, we also see the infiltration of many lymphocytes to help combat this infection. So this histological pathology image displays the comparison between the conditions of gingivitis and periodontitis. So as we can see in both of these images, there is dense lymphocyte infiltration, but a major difference is that in gingivitis, the alveolar bone is still fully intact, whereas in periodontitis, we see this alveolar bone resorption occurring.
Some prognosis conclusions and treatment. The early stage of periodontal disease, which is gingivitis, is reversible, and it can be treated with good oral hygiene and regular professional cleaning. The more advanced stages of periodontal disease, which is periodontitis, is the tissue damage that is caused by this is generally irreversible, and the treatment usually falls into two categories. The first one being procedures designed to halt the progression of disease, and the second one being procedures designed to regenerate structures destroyed by the disease. Possible treatments include deep cleaning of the tooth, root surfaces below the gums, and may include the prescription of medications to take by mouth or placed directly under the gums, and corrective surgery. Lastly, some demographics about periodontal disease. It is one of the most common human diseases. There are multiple different socio-demographic elements that play a role, one being race. For the age group of 30 to 54 years, 25% of non-Hispanic whites, 35% of Mexican Americans, and 42% of African Americans all have periodontal disease. For age, 47.2% of adults aged 30 years and older have some form of periodontal disease. Periodontal disease increases with age. 70.1% of adults who are 65 years and older have periodontal disease. And lastly, sex. This condition is more common in men than women. And here's our works cited.
Thank you.